Omicron suddenly changed everything. The coronavirus variant shifted the focus to boosters, restricted travel, and more home testing. Few governments are eager to return to the blanket lockdowns that rob so many people of their livelihoods. So what's the answer? Measures are becoming more targeted. In some countries, non-essential shops and recreational venues are off bounds for the unvaccinated. Pandemic dynamics. Whatever the measures, it's the timing that counts.
Ben Fazulin. Hi. It's a balancing act, the right measures to protect our lives and our livelihoods. Even the countries we thought were handling this pandemic so well are struggling to get the balance right, like South Korea.
Yoo Yeon-suk, Angela, and her husband run a restaurant in a new development on the outskirts of Seoul. When COVID-19 struck and restrictions on customers and opening hours were imposed, she cut overhead and prepared for the long haul.
My husband wanted to open a restaurant, so we started a barbecue place. This is a good spot, but it got tough when Corona hit out of nowhere. We reduced staff, but we're still struggling, doing our best for our customers. I hope the government supports small businesses with more rational measures.
Merchants are subject to fines and closures if protocols are not followed, and most people have now largely accepted the inconveniences, wearing masks and digitally signing in.
Especially for the elderly, it's not easy to use QR codes, so they got mad at me sometimes. But now a lot of people can use them, and it's getting easier, almost becoming a way of life.
In November, the government started its Living with COVID-19 policy, easing social distancing measures after vaccinations were up and COVID cases down. But they may not have been cautious enough. COVID-19 here has surged to new highs, with daily cases now topping 4,000. The increase in severe cases is absorbing medical resources, with concerns over a shortage of ICU beds and the diversion of attention from other patients. The medical community is calling for more robust measures.
We need to live with COVID-19 and go back to normal life by minimizing the damage. To protect the unvaccinated, include enforcing a strict vaccine pass and strongly encourage the unvaccinated to get vaccinated, either by incentives, penalty, or law.
This week, South Korea approved more emergency funds for small businesses. But Angela's concern goes beyond her finances.
I'm worried. Children are back to school, but some have not been vaccinated. I don't think Corona will go away completely. People will have to practice stricter hygiene, and we'll just have to live with it.
Angela hopes more restrictions can be avoided, but she accepts the extra challenges imposed on her business. Now everyone else must do their part.
Well, can we rely on that? A paper in the magazine Nature found that well-timed lockdowns can split the peak of hospitalizations into two smaller distant peaks while extending the pandemic. Let's talk about that and other measures with Sören Mindermann, one of the authors of that report. Tell us more about your findings.
Hello. We looked at the effectiveness that different government restrictions have had, especially in the second wave and the first wave, and how that changed over time. So, for example, and we looked at this across a whole range of different countries, finding, for example, that it's been effective to restrict gatherings to a certain number of people, 10 or 100. That's been quite effective, but there are also quite big differences between the waves. For example, closing schools was one of the most effective things to do in terms of reducing transmission in the first wave, but was less effective in the second. And this sort of goes to show the effect of safety measures that reduce the extent of transmission in schools. So, for example, reducing class sizes means that if you now close a school, there's going to be less of an effect because there's already less transmission happening in that school in the first place.
And your paper mentioned reducing the burden on hospitals, but lengthening the pandemic. I mean, I'm sure that's not something anyone wants to hear, a longer pandemic.
Yes, I mean, could you clarify the question?
Sure. I mean, what does it mean? How much longer would we have to wait out if we were to introduce measures like that?
Yeah, I mean, lengthening the pandemic can be a good thing because it buys us more time to. It's sort of the idea of flattening the curve, where we prevent that hospitals become overloaded. And then we can't provide good care for patients anymore because there's just too many in the hospital at the same time. Mm-hmm. Aside from that, lengthening the pandemic while keeping cases lower also gives us more time to vaccinate people and develop better tests, cheaper tests, so that we can basically control the pandemic more effectively.
Okay, so that said, and based on what you found from your study, what would you say are the best measures for this fourth wave? Right.
So I think there's actually a lot of similarity between waves here. So as there are a lot of different measures, I can't go through all of them, but as a general rule, restrict the measures that restrict the ability of big groups of people to meet in indoor spaces. That's where we think most of the transmission is happening. And we've learned that sort of slowly over time. This can make a lot of sense. So this can be restricting hospitality or gastronomy, large gatherings. It can also mean schools, although closing schools, although this is not going to be very popular at the current time, but in a scenario where perhaps Omicron turns out to be very transmissible and dangerous, in that scenario, could make sense again to do this. And then measures that also make a lot of sense, for example, mask wearing, because they are it's just not a big cost to society having to wear masks.
Sören, are there also interventions that you would say are good ones to keep beyond this pandemic?
It's an interesting question. Well, perhaps there's no such thing as beyond this pandemic because we're not currently on the track to bring the COVID cases down to zero. But I think what's most important actually beyond this pandemic is to prepare for potential new pandemics in the future, whether it may be soon or decades from now. So being ready, having the capacity to develop and roll out a lot of testing quickly, having capacity to building the capacity to produce vaccines quickly. That was a big bottleneck this time, and to quickly run the studies where you have to put 30,000 people in a study, test the vaccine on them. This took quite some time, although we sped it up. It could be even faster. So I think that's very important.
Sören Mindermann, thank you very much for being on the show today.
Thank you.
Time for a viewer question, and a good one for the vaccinated and unvaccinated. Over to Derek Williams.
Are there differences in the illness when vaccinated and unvaccinated people get COVID-19?
Yep, there are, and that's reflected by a more fundamental factor, which is, at this stage of the pandemic, how likely it is for a vaccinated person to test positive for the virus compared to an unvaccinated person. The CDC in the US is tracking this information, and its most recent update shows that unvaccinated people, so the black line, are nearly 6 times more likely to be diagnosed with the disease than those who are fully vaccinated, so the blue line. And don't forget that almost 60% of the population there is fully vaccinated. So that means that well over 4 out of 5 cases of COVID-19 being detected in the US at the moment are occurring in the 40% of the population that's unvaccinated. And the numbers grow much starker when we compare the average severity of the illness between the two groups. An unvaccinated person in the US is currently around 14 times more likely to die from COVID-19 than someone fully vaccinated who has a breakthrough infection. In other words, that 40% of the US population that's unvaccinated is counting over 9 in 10 deaths registered to the disease, as well as many, many more hospitalizations. Several studies going more in depth into symptom severity showed that in the vaccinated, the chances of developing severe illness if you're infected anyway are reduced dramatically. And in the Zoe COVID study, which tracks things like types of symptoms, people with breakthrough infections have mostly reported mild ones, like those that you have when you catch a cold, so things like a runny nose and sneezing, while unvaccinated people are more likely to experience fever or a loss of smell. In other words, there's some overlap between the two groups in exactly what symptoms develop, but also some really important differences, particularly when it comes to severity.